Hi everyone, my name is Lauren Hoyt, for those of you who don't know me. For my adult placement this semester, I was at Ahava Medical Outpatient Center, which is in Flatbush, Brooklyn. And the majority of the people I saw were adults, and I was also thankful to be exposed to the pediatric population as well. So for my final presentation here, I chose to use a client with the initials CC. His chronological age is 55 and 4 months, and his diagnosis is Broca's aphasia. His languages are English and French Creole being his native language, so he does have a pretty thick accent. His occupation is a supervisor at JP Morgan in Brooklyn. And the ICD-10 code I found for aphasia is R47.01. And the G codes I found for his deficits were spoken language expression, which is G9162, and memory, which is G9168. Oh, and I included an image here where in the brain his impairment was where it occurred, which most of us probably know at this point where it occurs, but just to remind everyone, here's an image. A medical history of CC. He was diagnosed with an acute ischemic stroke of the left middle cerebral artery. And he actually came in for speech services a week after the stroke happened. So he's very, very eager to get his speech and his other deficits back to normal as fast as he could. He's a very driven, hardworking man. Just from the sessions, I observed those characteristics in him, so it was very inspiring to see how dedicated he was to work on his therapy inside and outside of the sessions. So, due to the stroke, the deficits noted were expressive language, word retrieval, writing, and grammar, and no other health concerns were noted. So during the evaluation, which I was lucky enough to be a part of, me and my supervisor both conducted this evaluation. I was able to do the majority of it, but he helped me along the way. So I conducted an oral motor exam where I found paralysis in the right side of his tongue, lips, and cheek. Weakness of the tongue was noted when I asked him to exert force to the right side with the tongue depressor. And I also noted a swollen tongue, weakness evidence on the right side of the lips, tongue, and cheek. I also did a DDK test with CC. I also did a case history. We also did the Boston Diagnostic Aphasia Examination, 3rd edition, also known as the BDAE. I don't have the exact numbers recorded, but he was diagnosed with Broca's aphasia, and we also did a self-report on him where he described his speech being unintelligible. And also he had a swollen tongue where he saw an ear, nose, and throat doctor a few days before he came in to see us, and they told him that this is common in stroke and that the swelling would go down soon. So he also described the fact that he does have a swollen tongue, that this is what was creating some of his speech to be unintelligible, almost making him feel like his tongue was getting in the way a lot of the time, also when he was eating. And also his wife was there for the evaluation, and she reported difficulty in understanding his attempts to communicate needs at home or on the telephone as well. So, in regards to speech and language services, CC receives speech services 2 times a week. Therapy focused on increasing word retrieval ability and speech intelligibility. And we also used the Smalltalk Oral Motor app, which I was introduced to at my placement here. One of the speech therapists showed me it, that she uses with a lot of her adult clients who have oral motor deficits, and it was really fascinating how well, how easy, it was to teach my client CC how to use this, and it's very practical to use at home. There's not anything complex about the app, and he told me each session he would come in, he would tell me how he was using the app frequently, at least twice a day. So it was very amazing and rewarding to hear that he was doing these at-home exercises. So as I said, he was using the Smalltalk Oral Motor app to increase lip and tongue strength by working on these activities at home, and I also gave him word list with initial, medial, final, lateral, and interdental sounds embedded to regain tongue strength, because I did notice specifically from a language sample that these sounds specifically he was having trouble with, which made sense because of his swollen tongue that was getting in the way for a lot of sounds in speech that use the tongue, like interdentals and so on. So one of the long-term goals was CC will use functional communication skills for social interactions, such as greetings, social etiquette, and short questions, simple sentences with both familiar and unfamiliar partners with 90% success. One of his short-term goals was that CC's skill in supporting conversation with his wife will improve as rated on the MSC, Measure of Skill in Supported Conversation by Kagan et al., 2004. And another short-term goal was CC will demonstrate reading comprehension of 5-sentence paragraphs with 80% accuracy with minimal cues. Another long-term goal was CC will increase speech intelligibility of 3 to 4 word phrases from less than 50% in known contexts with known listeners to 80% in unfamiliar contexts with unfamiliar listeners. So a short-term goal was with multisensory cueing, CC will identify minimal pairs targeting initial consonant deletion, final consonant deletion, and fronting from a field of 2 with 80% accuracy in 4 to 5 consecutive sessions. And according to Wambaugh 1999, using minimal pairs to target speech intelligibility can be of much benefit in improving expressive communication in aphasic patients. Another long-term goal was CC will improve his word-finding skills in a variety of settings, work, home, and therapy during spontaneous speech. A short-term goal was CC will increase his spontaneous speech from the word level to the 2-word phrase level using response elaboration training with minimal cueing in 4 out of 5 trials. And an article I found by Connolly, 2003, he focused part of his article on response elaboration training, and he noted how it is a highly reputable treatment approach to aphasic patients who have word retrieval deficits. And that is all. Here is my works cited page, and this client was a joy to work with, and I saw much progress in a very short time span, which is very rewarding to see, especially just as a student clinician, to see this early in our career, how progress can be made and how you can definitely make a positive impact on your clients' lives. And that is all. Thank you.